So I'm Michelle Diaz, and I'll be conducting a physical assessment on a patient. I have gathered my equipment, I've provided privacy, and I've already washed my hands. I've explained to the patient that I will be conducting a physical assessment on his head, his neck, his throat, his heart, and his lungs. And I would start the assessment as soon as he walked in. I'd be assessing his gait. I'd be looking for a smooth movement to his walk. I'd want to see if he was coordinated, and I'd want to take note of any kind of involuntary movements. So I'd go ahead and first I'd check out his general appearance. I would see that he's generally clean, neat, his clothes are appropriate to the season. I'd want to go ahead and assess any kind of obvious physical deformities, so any kind of obvious asymmetries or discoloration. And throughout the entire assessment, I'll be assessing his skin. So I'll be looking at the temperature of his skin, the color, that it's consistent with his ethnicity. I'd be looking for any rashes, excessive bruising. I'd want to take note of any moles. Any kind of excessive dryness or moisture. I'll be looking at all that in his skin throughout the entire exam. Next, I'd go ahead and take a look at his hands. The skin on his hands are the same as the rest of him. His palms are nice and pink. His cap refill is under 3 seconds. His nails, I'd want to assess that their angle and that they're smooth and that they're clean, which they are. So I'd also want to take note of his affect, his facial expression, and his mood. I'd want to make sure that his speech was clear and understandable. So if you can you tell me your name?
Peter.
Okay, can you tell me your date of birth?
1491.
Okay, can you tell me where you are?
Mercy College.
All right, and do you know what day it is?
Thursday, November 20th.
All right, good. So the patient is obviously alert, and he's oriented ×4. He has good eye contact. Can you go ahead and smile for me? Okay. His facial structures are symmetrical. Okay, so I'm going to go ahead and start his head assessment, and I want to assess that his scalp is free of lesions. I want to see if he has any kind of pain or tenderness. Do you have any pain or tenderness?
No.
All right, and I want to assess that his skull was smooth, symmetrical, that I didn't notice any kind of abnormal protrusions or depressions. I'd want to know that his hair is not dull or brittle. Okay, and so I'm going to check his temporal arteries. I'd see that they're strong and equal bilaterally. Can you open and close your mouth? Okay, keep that again, good. And I'd want to see that that motion is symmetrical, and that I didn't feel or hear any kind of crepitation, and that I didn't feel any kind of limited range of motion. Next, I'll be assessing my patient's eyes. Okay. So I'm going to shine a light in your eye. I'm going to come in 2 times from the side on both sides. So my patient's eyes are, or his pupils are equal, round, and reactive to light. If you look at my finger. I wanted to see that his pupils accommodated, so whenever my finger was close, his pupils would dilate, or his pupils would constrict. When I was farther away, his pupils would dilate. Next, I'm going to do a confrontation test, so if you'll cover one of your eyes, whenever you can see my fingers, go ahead and say now.
No.
Okay, now cover the other eye. Good. Next, I'm going to test his 6 cardinal positions of gaze, so if you'll follow my finger. Next, we're going to do the cover test. So if you'll cover one of your eyes, look at my nose. Okay, good. Cover your other eye. Look at my nose. Good. Next, we're going to do the corneal reflex test, which I'm going to shine a light in both of his corneas, and I want to see where the light shines. I want to make sure that it shines in the same spot whenever I go over the cornea. Next, I'm going to do the red reflex test, which I want to see a red glow whenever I shine the light into his pupil.
Yeah, because distension would be the
Okay.
thing, right? 'Cause the bladder, if it's distended, we kind of want to know that.
Next, I'm going to go ahead and look at his cornea, or conjunctiva, and his sclera. I want to make sure that his conjunctiva is pink and moist and that his sclera is white. I would conduct I'd test his visual acuity by having him look at a Snell chart, and I'd have him 20 feet away from the Snell chart, and I'd have him cover one eye and read down the line of letters and until he reaches the line that is as much as he can read, to the smallest line, and then I'd have him cover the other eye and repeat it. So next I want to go ahead and assess his ears. I'd want to initially look at his ears, that they're symmetrical, that the skin of his ears matches the color of the skin of his face. I'd want to check for any kind of any lesions that I might see on the outside of his external ear. And then I'd go ahead and look inside of his ear, and what I want to look at is first at his canal to see that he doesn't have any kind of discharge, swelling, redness, any kind of obstruction. And then I want to look at his tympanic membrane to see that it's shiny, that it's translucent, like a pearly white. So if you'll slightly tip your head.
If they're, say, over 55, we would probably use a coude. No, it's
Any kind of pain or tenderness at all?
Enlarging prostates. So even though they may not have officially been diagnosed with an enlarged prostate or BPH, they still may have some to some extent.
Next, I'm going to conduct a whisper test. So if you could cover one of your ears. I'm going to whisper 3 numbers into your ears. I want you to repeat them.
More so than we didn't use the
5, 7, 8.
So we have to have that in mind. Age of the patient, whether or not they have a BPH history, and if they're over 55.
6, 9.
Okay, good. Next, I'm going to assess his mouth.
Yeah, you should have that option.
I'm going to look at his mouth. I'm going to see that he doesn't have any kind of missing teeth. I'll be looking at his buccal mucosa, the floor of his mouth. If you lift up your tongue, good. And the hard palate, I want to see that it's hard, smooth, and that everything looks pink and moist. Alright, so if you'll stick out your tongue and say, ah. Okay, I can see that his uvula is midline and that I can see his tonsils, so I'd grade them at a +1.